A term that I like better is probably optimal spine. So the optimal position of your spine, you have an inward curve at your neck, an outward curve in your upper back, and an inward curve in the low back. And when those curves get out of alignment or out of position, that's when we start to develop a lot of problems, because then the muscles get out of balance, other joints get out of balance, and it can kind of create a cascade of events that can cause an injury. So we initially try to teach learning these curves, and one of the best things to do with that is basically just an elongation through the spine. So always, and this spine model has a nice little cue here with this that it hangs on, is that it just, you want to feel almost like you're lengthening through the crown of the head, helping to restore some of the curves in the spine. So when we start to sink into the spine a little bit, we start to compress, and then we end up with lots of issues there. Now we're going to work on finding a neutral spine, and I'm going to take Heather through a few movements of pelvic tilts to try to find neutral, and then we'll talk about the muscles and how they help keep us there. Okay, so Heather, I'm going to have you bring your hands onto your pelvis, so the hips here, so just right at the top bones. And then let's do a posterior pelvic tilt, so you draw the tailbone under, and then go into an anterior pelvic tilt. And just keep going through that range. So you can see when she flexes, she's flattening the back, and then extension, that's going to cause some compression. And then to find a neutral position, you just kind of settle in the middle. So you find, and if you were to take your hands, if you take the heel of your hands onto the bones of the pelvis and then the fingertips down to the pubic bone, that should be perfectly flat. Okay, so not tilted one way or the other.
So when she says bones of the pelvis here, she's talking about this ASIS. And so you can find that, it's just kind of the little point right here.
Once she finds her neutral pelvis, I'll just have her kind of stand tall. To find the core muscles, go ahead and take your fingers, Heather, and bring them, find your belly button, and just go out a few inches so that you're still on the fleshy part. And then if you do a little cough, or you can, as if you're blowing out a candle, you will feel a muscle pop up under your fingers, and that is your transversus abdominis. Your obliques are helping out, but that's going to kick in to help you feel. And then the goal would be that we keep a little bit of that engaged as we're going through some exercises, and that's all going to depend on how hard the exercise is, or how easy, or how much it is kicking in or not.
Pelvic floor.
And then, so pelvic floor, yeah, you want to keep just a gentle engagement, especially for women that have had children. You want to keep the pelvic floor pulling up, but you do kind of want to feel the synergistic movement of the diaphragm and the pelvic floor. So you don't want to pull up and tighten and then not breathe. So the breath still has to drop down, the diaphragm still has to drop down, and that's where that expansion, you still want to be able to expand all the way around the torso as you're breathing.